All right. So now that we've done that important group of the erector spinae, the hard one, the rest is honestly pretty easy. So let's go and figure them out, right? So the one thing we have to do that sort of is going to be kind of on the edge between the muscles of the shoulder girdle and the muscles of the back is a form called the rhomboids, which is in fact rhomboid major and minor, but we're going to put them into a single group. So let's say origins of this. That's a separate layer. Good. Origins of the rhomboids is the spinous processes, as always, right? Spinous processes of C C7 to T5. Now C7 to T5, um, yeah, there's also, of course, the supraspinous ligament, right? Always remember that that is the thing. So let's figure that out. So where is 1, 2, 3, 4, 5, 6, and so that would be right there. And then uh, and then we have, of course, T1, T2, T3, T4, and T5. Insertion of the rhomboids as a group, right? Basically, the rhomboid major is T1 to T5, and then the rhomboid minor is right above that on the last cervical vertebra, right? So, but you can kind of unify them all into one thing. So, I would say insertion, medial border or edge of scapula. Um, from the spine down to inferior angle. Okay, wow, that was crazy. Okay, so yes, the medial border, so right here would be that. Right, that's easy to show, but the words, you need them words. So then here it looks something like this. So those are the rhomboids, right? They will go right above the erector spinae. Everything goes above the erector spinae. Now that that's there, we can go to what we probably already are aware of, right? So let me just I get this smaller, but it's okay. It's okay. It's fine. The next thing is called the latissimus dorsi. So we already counted longissimus, right? Longitude, and latissimus, latitude. Latitude means, right, how wide it is. Longissimus means how long it is. So latissimus, like longissimus, means, and dorsi is of the back. So essentially, the longissimus, sorry, the latissimus, or we can call them lats in exercise language, the widest muscle of the back. Okay? So here is a very, very hefty origin for this. So, let's start with the spinous processes of basically starting from T8 all the way to L5. right? So that's basically from T8 all the way down the rest of the spine, continuing down those spinous edges, right, of the sacrum. Of course, all the supraspinal stuff, right, all that we know, and the posterior part. So it's very similar to the erector spinae, and the posterior part of the ilium, the iliac crest. We're not done yet. We have, I would say, R8 to R12 as well. And the coolest thing is the inferior angle. Oh, I forgot the right angle there. Um, to the inferior angle, right? So inferior angle of scapula. Isn't that crazy? So what does that look like? What does that look like? That's pretty intense. So basically, let's get the lower ribs. So 12, 11, 10. Oh, I'm sorry. Yeah, R8 to R12. I apologize about that. That's actually incorrect. Wait a minute. That is correct. What am I talking about? Yeah, I think we're good. I'm sorry. Let's get these ribs. So R8 to R12, right? Oh, that's why it's not correct. I'm sorry. Yeah. So because of counting. Isn't that interesting? Because if you count them, it changes it slightly. It's R9 to R12, 9, 10, 11, 12. And a similar thing right here. So please make that correction. T9 to L5, because it's the same kind of idea, right? And then we're already there. So from this point, we're going to go all the way down here, all the way to here. All of this stuff right there. Right? That's pretty crazy. And then right here. So that's a lot. Insertion. The intertubercular groove of the humerus. Isn't that cool? Same place as the pectoralis. Not exactly. It's underneath it. It's underneath the insertion of the pectoralis, but the absolute bottom of that groove. It's fairly long, but so let's sketch this out and see what this looks like. So what this looks like is the following, right? So it basically, this is not the greatest kind of thing. Let's enlarge this a little bit, right? So we're going to do this, and there's going to be a twisting, as often there is with this kind of stuff, right? Right there. I'll sketch that out a little bit more in detail. And then we're going to have something that looks like this, and connecting all the way to there, right? So I'm going to just color all that in, but make it a little bit more transparent for our sake. Like that. So that's pretty cool, but I'm going to add a few things. I'm going to add a tendinous area. Not like that, of course. The tendinous area is going to be here. No, I'll just do it like this. All along the spine and then expanding outward here. So the origin is very tendinous. And this is a very important thing. Like that. Because the muscular parts here are going to might have a little bit of an edge there in this area because they can't overlap the tendon, so you can really usually see that area. And you can see that twisting too. So obviously it's on the anterior humerus, right? So this is what we have right there. That's what's happening, kind of like that in terms of the muscular area. And then right here, just so we know, right? So you're beginning to notice there's a lot of tendons here. The erector spinae tendon origins, as well as the latissimus tendinous origin. Here, by the way, we have the form of the serratus, the serratus anterior. Oh my God, the serratus anterior, and we know them from the front, right? Because they have that serrated edge. But from the back, they're actually creating a ridge like this. So if you see that, that's what's happening there. Okay, so that's that. Um, that's the latissimus. One very simple insertion to remember. And now we're going to get to, let me just slightly recrop this crazy thing. Crop it this time. Let's get this smaller, bring this up, extend that way. We're going to get to one that we've all heard of, the trapezius. Let me just see if I'm recording, always make sure. The trapezius, right? The trapezius, I guess it looks like a trapezoid in some way. But the trapezius is not so easy, right? Because it has multiple parts. So let's figure it out piece by piece. Origins. The origin of trapezius is fairly easy. So it's the nuchal line and the occipital protuberance, the nuchal ligament, which is not the nuchal line. We haven't done that, and I don't want to really go too much over that, right? But it's basically something that looks like this. Oh, and the spinous processes right there too. So I'm going to sketch that out, right? So there's a line on the occipital bone right here, which is called the superior nuchal line. There's an inferior nuchal line, a bunch of other stuff like that. So why don't we just call it occipital bone? Right, that's the back of the head. Occipital bone of skull, which is obvious, but let's make it a little bit clear. That's that, right? Let's call it that. And then that all the other stuff I mentioned is sort of implied. Let's say it's implied. And then well, the best part is that it's the spinous processes all the way from the atlas all the way down to the bottom of the rib cage, C1 to T12. Isn't that awesome? I think it's one of the most awesome, the kind of one of the coolest origins that we have here. Now, insertion. Here's where we have different parts, right? So let's start with the upper part. So they all have a common origin. It's all of this stuff. But the upper part, that's just what it is. And this is going to be interesting. The upper part inserts. This is a strange way to write it. Hold on a second. I'll clear this up. Let me erase that. The upper part, insertion, is the acromial portion, which we remember of the clavicle, right? So of the clavicle. Now that's cool too. Which is, of course, the lateral one-third of the clavicle, right? That's very, very, very cool. So it'll go from the top, it'll go something like that, right? It'll kind of move its way that way. That's in front. Even that's not so correct. Essentially, it's just like this, right? It's just that part. We can't see it here. I'll have a different sort of color coding for each. I will try. But it will connect to the clavicle right there. So it's the clavicle on that side. So if you're looking at it, sorry, it was the wrong clavicle. Like this, right? You're here, and then you have all this stuff. It's the form that's coming around like this that you can see, and you can really like it's very prominent on people, so you can really like even feel where your own upper portion, the trapezius, is as it begins to connect to the acromial portion there. Okay, so I'm just going to erase that. We'll do tons of that stuff in class. Let's move down to the next part, which is the middle part. That's weirdly larger. No, not that. Now, the middle part, also cool, is the acromion, right, of the spine of the scapula, and entirety of the upper margin of, we'll do this, of spine of scapula, excluding, this is going to be weird, the triangular expansion at the base of the spine of the scapula. This becomes important. I mentioned this, I think, at some point in brief. This right here, it's not modeled in this thing at all. There's a triangular expansion there. It does not cover that. So it'll do something like this. It'll go all the way like this, right? They kind of overlap a little bit, as always, right? Everything kind of something like this. And continue like so, all the way to there. Okay? So that would be, right, but it'll insert into here. I'm going to just clean this up a little bit. Into here, leaving the spine of the scapula open. Oh my God, look at the spine of the scapula. Look how they modeled this. It's hard to find a good one online, I got to tell you. So that would be like that, right? Excluding that tiny part. Now, of course, we have the upper part and the middle part. So we have the lower part. And the lower part is, I would say, the medial, let's say, possibly a third or even less, a quarter of lower, right? This was upper margin. This is lower margin of the spine of scapula. And they're, of course, also excluding the triangular expansion at the base. So what does this look like? From all of this stuff, it's going to move all the way up and do something like this. And I'll show you how that happens. So something like that. And how this actually begins to work, actually kind of wraps around a little, kind of comes underneath, is because of certain tendinous areas, right? So I'm going to outline them, and then we're going to talk about them. So the trapezius has three important tendinous areas. Two are origins, and one is an insertion. The two at the origins are at the bottom, so around, let's say, T11, T12, and not that important. But most importantly here is a tendinous opening, and the reason why we have the spinous process of the seventh cervical in this area is because of the fact that there's no muscular portion that's covering it. Okay, that's kind of the reason why that is happening. So, but now those two are at the origin. I should have made them red. That and that, right? And then the green one, which I can't do anymore, but I'll do it in blue, is this one right here, which is a tendinous area kind of on and slightly below even the triangular expansion at the base of the spine of the scapula along the medial edge or border. So that is very cool. That's there because essentially this moves up and inserts into it, and by means of this tendon is inserting into the medial part of the lower margin of the spine of the scapula. But here too, that's happening, right? Here too, that's happening, right? The middle portion, when it kind of reaches the more medial parts of the spine of the scapula, begins to insert into that tendon. And then you have certain important structural things going on. Let me just slightly make this less opaque. But the structural things, right? Sorry. Look like this, right? You have this mass right here, and it continues upwards, and kind of has to squeeze right here. So you're going to get the thing happening like that. And then you have this sort of mass happening like this, right? So they kind of do something like that. So you're going to have a lot of these structural things going on that kind of squeeze the forms in between the origins and the insertions. And because the scapulas move, we're going to be able to see more, or more of them, greater expansion, possibly showing maybe some kind of curvature of the rib cage or not. Right? The same thing is happening with the latissimus, and we're going to see that when the arm moves out and it's expanded, you're going to see the curvature of the rib cage underneath much more prominently. But when it is compressed, we have all these forms underneath, including the lateral portion of the erector spinae, and then the edge between the tendinous and muscular portions of the lat itself. Right? All of that gets combined, and not to mention that the erector spinae is then composed of a ton of other small things that sometimes begin to sort of show themselves a little more prominently. The last thing is, right, that we have our trapezius. When the scapula moves that way, you're actually going to get that gap between the inferior angle and the trapezius, in which, I'm kind of exaggerating here because it's not moving, in which you're going to see the little sort of triangular opening, and inside, are the rhomboids. So those are the muscles of the back. That's pretty cool. I said that was the last thing, but the real last thing is, remember all these tendons right here? Kind of that all of this just sort of in this area. This is called, much to sort of to parallel what's happening in front. This is called the lumbar aponeurosis. That could aponeurosis, right? That connection of all the tendons of the erector spinae, the lats, all of that, right, is all to they create this tendinous covering in the lumbar spine that is the lumbar aponeurosis. And in fact, the internal obliques actually connect to the lumbar aponeurosis, but you also remember that they are in part connected to the abdominal aponeurosis. So there's a nice sort of continuity in this area that kind of wraps around. Everything is connected to everything else. That's the best part about anatomy. Whew, that was a lot of stuff, but this one's super important. And can't wait to do some more practice assignments in class. I'll see you there. Oh boy, what was that? Sorry.